Sweden, and my son Edvard, he was born after a completely normal pregnancy and delivery in January 2021. And he was perfectly healthy until he was 6.5 months old. He then developed a rash, and then 2 weeks later a fever. And after just over 2 weeks with a fever, he was admitted to hospital. And lots of tests were taken, and genetics was also done, the whole exam, but without finding an explanation. But as secondary findings, however, a gene mutation that can cause cardiac arrhythmias, Brugada long QT syndrome, was found. And so was a gene mutation that can cause or is linked to variable immunodeficiency. But he has no signs of it, and his immunoglobulin are normal. But after 3 weeks in hospital, Edvard was put on Kineret, or anakinra, 2 milligrams per kilo. And he responded well to it at first, but after about a week, he went into MAS, and his ferritin went up to 88,000. He was treated with dexamethasone according to the HLH 2004 protocol, but the fever did not go away until the dose of Kineret was increased to 10 milligrams per kilo, divided into 2 shots per day. And he was hospitalized for almost 3 months, and he suffered both pneumonia, sepsis, and a blood clot during that time. And only a month after we came home from the hospital, he became ill again. He became as if paralyzed, and he could not oxygenate himself. So he was put on a ventilator, and after many tests, we found out he had botulism, a really, really rare condition. And we don't know how it happened, but doctors believe his immune system played a role on it. And this led us to spending another 2 months in ICU, and afterwards a very long period of rehabilitation followed. And he was then stable with normal labs and no clinical symptoms for about a year. He was treated only with high doses of Kineret. But he then contracted COVID-19, which triggered another relapse. And he had smoldering MAS for a few months, which then developed into full-blown MAS. And there a long, unstable period began, despite high doses of prednisone and anakinra, or Kineret. And we had read several articles and patient stories about lung disease, and we realized that Edvard met several of the risk factors. He had young age of onset, recurrent MAS, hypereosinophilia, only systemic. So after a long time of raising our concerns, we finally got a CT scan in June 2023, and it showed ILD, and a bronchoscopy showed PAP. And when this was discovered, they made an attempt to switch Kineret to Xeljanz from day to day, but he went into MAS in 36 hours. So they stopped the Xeljanz and returned to Kineret in combination with high doses of prednisone. But he got more and more clubbing, and his labs were bad. His hemoglobin was below 80, you might say 8, and he was pale and tired. But after his doctor consulted Gosh in London, baricitinib was added. And he's now on 4 milligram baricitinib and 150 milligrams Kineret per day. And he also takes Bactrim twice a week as a prophylaxis. And he has been able to wean off of the prednisone completely, and his labs are completely normal, except for IL-18, which has, however, decreased with each testing. The first time it was tested in July 2023, it was 165,000, and now it's down to 38,000. And he has no symptoms of his lung disease, except from clubbing, barrel chest, his chest points outwards, and a slightly faster breathing than normal. But his oxygen levels are completely perfect. It's 98 during both day and night. But because of all the steroids, he has lost some of his growth. But overall, however, he's doing really well after baricitinib was introduced. And the latest CT scan showed status quo, so it's stable. And he goes to kindergarten, he's not sick more often than his friends. And he's, a very happy and active kid. And you wouldn't believe he's sick. Yeah, so that's our story.
He's still not growing?
Yes, he is. Since we stopped the steroids, or since he became stable, he has grown a bit. So a few centimeters in a couple of months, despite baricitinib.
Can you mention the concerns about some fibrosis and they should be checking there?
They have done a biopsy and bronchoscopy, and they found some fibrosis. Most of it are inflammation, but he has some fibrosis already. Okay, thank you.